with Brett Elliott.
Crohn's disease is caused by ulcers in the gut. What could be causing this Crohn's disease and this inflammation and ulceration of the gut? And this bacteria allows the ulceration to take place. Today, what I'm going to share with you causes, the symptoms, the things that you can do with food, diet, and herbs to resolve Crohn's disease.
Herbs. Healing. Secrets. The secrets of herbal healing with Brett Elliott.
If you know somebody that's been diagnosed with Crohn's disease, or if you have yourself, you'll know how difficult this condition is for the mainstream medical system to treat. In fact, they don't know really what causes it or really how to deal with it long term and resolve it. It's one of those things they say you'll just have to manage and you'll be given a few drugs that you'll have to take. But the good news is with diet and with herbs, it can be resolved. I've seen it resolved in many of my clients. And today what I'm going to share with you is the causes, the symptoms, the things that you can do with food, diet, and herbs to resolve Crohn's disease, potentially heal yourself from it long term. So it's going to be really interesting. I'm going to share a web page with you. There's a QR code in the top corner there if you want to go to the web page, and there you can look deeper into some of the research behind what I'm talking about as far as the herbs and the foods go. All right, so let's get into it. Yeah, so Crohn's disease, one of the most painful and difficult problems, digestive issues there is. It's called an autoimmune condition. It's generally classified as an autoimmune disease, and it's very, very problematic for people that have it. But there is hope, and that's the good news. So let's just look at what Crohn's disease is and how it's classified. It's called a chronic relapsing inflammatory bowel disease. So not to be confused with irritable bowel syndrome, which is another inflammatory bowel disease. Crohn's disease is much deeper and more difficult to deal with. It's characterized by what they call transmural granulomatosis inflammation, or to put it simply, deep ulcers. In other words, Crohn's disease is caused by ulcers in the gut. Now, you probably all heard about stomach ulcers, which are much more common. So these are deeper ulcers that can proliferate throughout the gut, through the small intestine and the large intestine, much deeper and much more problematic than stomach ulcers. Most commonly affects the small intestine and the large intestine, and often it involves both small intestines and large intestines. So this points to the fact that whatever's causing the Crohn's disease is a general, more systemic gut issue, that it's not just in one isolated area. It affects about 1 in 500 to 700 people, and there's been an increased prevalence in the past 50 years. So there's an increasing number of people suffering with Crohn's disease. And the highest incidences in Northern Europe, United Kingdom, and North America. And guess what? That's where the most affluent and abundant food supplies are in the world, especially processed industrialized foods. So we'll look at the connection there a little bit later on. Oh, and by the way, what you can see here is an indication of, see this gut wall, the gut lining here, that's a healthy gut lining. See how much thicker this one is? It's become thickened. And it's also got a fatty layer build up on it. So it's a build-up of fat in the visceral tissue here, which is going to be causing this thickening of the gut wall. So that's an interesting thing. We'll come back to that a little bit later, but how that's connected to the whole pathology, etiology. So you can see here the areas shaded in red, the small intestine and the large intestine. And these areas that are showing where the inflammation can be. And there's your normal gut. And there's your thickened gut wall with your fat wrapping around it. So there's obviously an issue here with the fat and the gut wall. And showing here the fissures or the ulcers, so deep, almost like gashes or cuts in the gut wall where the ulcers are. So while it mostly affects the intestines, it may occur anywhere from the mouth to the anus. So these ulcers can be right through the body, and you can just imagine how painful that would be. If you've ever had a mouth ulcer, just the pain that's related to having an ulcer can be tremendous. And it affects people between the ages of 15 and 40, higher risk in smokers, and it can also run in families. So there may be a genetic susceptibility. But I often think these genetic susceptibilities are more like tendencies, and they can often be related to diet, lifestyle, and mindset. So those things are also inherited quite strongly through our families. Females are 10 to 30% more likely to develop Crohn's than men. And you'll often find this with digestive disorders, and that's due to the stress factor. Women tend to suffer more with stress and anxiety and depression. So there's a direct correlation between mind, body, stress-related conditions, psychological conditions, and digestive conditions in general. So here's some of the symptoms that you'll experience when you've got Crohn's disease. A loss of appetite. And obviously, if you're not feeling well in your gut, you do tend to lose your appetite. Blood in the stool. So these ulcers can actually be releasing blood into the gut, the inside of the gut, as they, basically fissures or lesions in the gut wall. Fatigue, and this can appear like chronic fatigue. It's just insufficient digestion going on due to the inflammation. Fever, so that's an immune response. We'll talk about why there's an immune response in a minute. Mouth sores, so these could be part of the actual ulceration in the body. Stomach aches and pains and cramps. Weight loss, that's due to insufficient digestion again. And diarrhea, a bit like you would have with an irritable and inflamed bowel. The most common symptoms are the cramps and pain, the extremely painful condition. Loss of appetite, weight loss, pain when going to the bathroom, watery diarrhea, blood in stools, swollen gums, and DNA in feces, which indicates damage to the gut lining. Less common symptoms, joint pain, spondylitis. So in other words, inflammatory conditions right throughout the body can result from Crohn's disease, including psoriasis, inflammation of the bile ducts, and ulcers on the legs. So that's in extreme cases. Here's a microscope picture of the gut wall showing the inflammation of the small intestine, the ulceration here, the lesions, and the thickening of the gut wall. So no single test exists for diagnosing Crohn's disease. The widely used method is ileocolonoscopy and biopsies. So they can also put cameras into the body. So you can have ultrasounds or CT scans to see the thickening of the gut walls. But a relatively new technique is a camera that they put on a capsule and put down inside the gut. So they can accurately diagnose this by about 15%. You can do laboratory antibody testing, because some antibodies, these ones here, have been linked with the condition. So that's an immune response that's going on. You're getting an antibody production. The body's immune system is responding to the problem with the gut. And that's quite explainable because a large percentage of the gut's immune system, the body's immune system, is housed in the gut. And the gut has a massive immune system that responds to antigens and pathogens all the time. What we want to talk about now is what could be causing this Crohn's disease and this inflammation and ulceration of the gut. Why is the body attacking itself? Well, it appears to be attacking itself. The immune system starts to attack the gut wall. Why is it doing that? The exact cause of Crohn's disease still remains a mystery to mainstream medicine. But I think not so much. It just hasn't been, because it's multifactorial. It's very hard, when a condition is multifactorial, it's very hard for modern medicine to isolate the cause, because they want to isolate a singular cause and reduce it down to one thing so it can be treated with a pharmaceutical drug. That's the approach with science these days. So if they can't isolate one cause, they can't develop a drug to treat it. And that's where herbal medicine is really fantastic. And using diet is an incredible approach, because it's multifactorial. Why does the body attack itself? It attacks itself when there's some kind of invader or pathogen or antigen, or something that's seen as foreign to the body. And these could be toxins, environmental toxins, or ingested toxins. And if you want to dig into toxins, there's a whole nother discussion around that. But there's literally hundreds of potential toxins that we can get into our body. Irritants or allergens, which cause inflammation. Pathogens and bacteria, they could be viruses, bacteria, and so on. Other microbes or parasites even. And well, bacteria is the one I want to talk about mostly. So Helicobacter pylori. This is the most common bacteria with ulcers, stomach ulcers, mouth ulcers. So this is a bacteria that, when it becomes prolific in the body, it starts to basically attack the body tissues, and it weakens the mucous membrane and the mucosal lining of the digestive system. And this bacteria allows the ulceration to take place. We know with herbal medicine, when we have stomach ulcers, we use anti-Helicobacter herbs to treat the ulcers. This is going to be a good approach when it comes to Crohn's disease. The antibodies that have been found with Crohn's disease are connected with an immune response to intestinal gut flora or microbiota. In other words, the bacteria in the gut. So you can see right away, the antibodies are connected with a bacterial invasion. And this is more than likely going to be the Helicobacter that's causing the problem. So when the gut microbiota is out of balance and overpopulated with Helicobacter pylori, the immune response is activated. So we get this autoimmune response. And if the bacteria is housed in the gut, in the little fissures in the gut, then the immune system is going to start attacking those areas in the gut where the ulceration is taking place. I mean, so you end up with a cascade, like a vicious cycle of the immune system attacking a healthy gut, which would otherwise have less inflammation. So it's causing a lot more inflammation, and that can cause what's called leaky gut, where the inflammation causes the gut membrane to expand, the bacteria can get in there, the ulceration gets worse and worse, the immune system keeps attacking, and so you've got an ongoing downward spiral of inflammation and ulceration taking place in the gut. This is what we need to address, solve the issue of Crohn's disease. We need to stop the immune system activation. We need to get rid of that invasion of Helicobacter. We need to support a healthy gut microbiome and reduce inflammation naturally. Encourage the healing of the gut wall and promote a balanced immune response. So regulate that immune response. There's a lot of healthy, natural ways to do this with herbs and food. But what the medical system do, they use a completely different approach, which is steroids. Because it's known steroids reduce inflammation and they deactivate the immune system. But it's a trick. It's not really healing anything. It's just switching off the immune response, reducing inflammation in the whole body as a byproduct of steroids. And of course, what happens with these steroids is you get addicted to them. You need more and more and more to get a response. And of course, that depletes your body's own production of steroids. And so it's almost impossible to get off the steroids, like prednisone, for example. So you get increasing resistance on dependence over time. This is exactly what we want to avoid. We just don't want to go down that pathway. Powerful anti-inflammatory drugs that can help bring down some of the inflammation, but they're still not healing the problem. It's not getting the root cause of the issue. So you become dependent on these drugs while your gut is still in an unhealthy state. Immunosuppressants, okay, so let's deactivate the immune system now. So we've done, these things are valid approaches, they work, but they're short-term, they're quick fixes, and they're not healing the body. And that's the problem with pharmaceutical medicine these days. So let's look at natural solutions to do those things we talked about earlier: reduce the inflammation, repair the gut lining, support the healthy microbiome, and address those Helicobacter invasion. Worth a mention, antibiotics. If you've had lots of antibiotics over the years, and quite often you'll get antibiotics if you do have Crohn's disease, they may give you antibiotics as a treatment course, then you've really got an ongoing cascade of problems. So we need to get that microbiome, because the antibiotics will destroy the healthy gut bacteria and the healthy microbiome. So we need to rebuild that. Also, fungal overgrowth has been observed. And of course, when your microbiome is down, you will get fungal overgrowth, or candida specifically is the most common one. Let's look at what we can do with diet. Address the underlying causes of Crohn's disease with diet. We want foods that reduce inflammation, heal that gut wall. We want smooth, simple, easy digestion without a lot of inflammation. And we also want to use foods that are going to help reduce that bacteria. We don't want to be feeding that Helicobacter. Some of the foods that are known to increase Crohn's disease include high intake of fats, especially polyunsaturated fats. So this is nut oils and seed oils. Processed meats and red meats, trans fats, so things like margarine. But a lot of foods have many trans fats in them, or processed oils and fats. Canola oil is probably the most widely used one. Red meats and processed meats are very acidic and very inflammatory and very hard for your body to digest, and require a lot of acid. So quite often they'll get through the gut partially digested and cause a lot of inflammation in the gut and disrupt the microbiome as part of the process. Going on a more plant-based diet can be really helpful. A high fiber diet of fruits, fresh fruits and vegetables will help. This may be counterintuitive in the beginning, because you might think that fresh fruits and vegetables are going to cause more aggravation to the gut. But when combined with herbs, you'll counter that and you'll get the benefits without any kind of side effects from having those fresh fruits and vegetables. Foods rich in microorganisms to repopulate the gut. So there's your probiotic, prebiotic foods. Probiotic foods such as yogurt, prebiotic foods such as fiber. They work nicely together to repopulate the gut with a healthy microbiome. So here's some of the specific foods that we can do to address Crohn's disease. Avoid especially these processed foods with a lot of fats in them and too many fried foods, especially meats, not the fried meats, processed carbohydrates, sugary foods, too many glutinous foods, and foods that have got these additives of fats. Over here, we've got some of the sulfur-rich foods, so the brassica, and some of the nightshade foods. They can be a problem too. And what I suggest to resolve those issues really is to cook these foods really well, and you'll avoid the issues that come with those. So they're there because when having raw in salads, they can release a lot of sulfur and gas and become inflammatory. Some people react to nightshades, brassica, for that reason. So yeah, just make sure you cook them really well, and you can actually get away with those as well. The beans, nuts and seeds, they can cause a lot of gas and bloating and be largely indigestible. So don't have too many nuts. Have foods that are soft and easy to digest. The fatty, greasy, over-fried foods, packaged cereals and crisps, all the things with those trans fats and artificial sugars in them. Avoid those. Nightshades, it's best to avoid them or cook them really well. Spices can also irritate the gut. However, cayenne pepper is an exception. And the reason cayenne pepper is an exception is because cayenne pepper is known to specifically target Helicobacter pylori, which is the bacteria specifically related to the ulcerations and causing those ulcers. You might think cayenne will burn an ulcer. Well, it might have that burning effect initially, but what it does is it kills that bacteria, and then the pain is relieved, and you'll find the opposite than burning. You'll get pain relief. So cayenne pepper is used for pain relief with stomach ulcers specifically. So there you go, really good tip, that one. Some of the foods to eat: coconut milk and coconut oil. And coconut oil I've used a lot with people with ulcers. And in fact, if you get an ulcer in your mouth and you get a little bit of coconut oil and you put it on there, instantly the pain is relieved. And you'll be amazed how quickly you can relieve mouth ulcers with coconut oil. Manuka honey does a similar thing. They both have specific antibacterial effect on the bacteria, the Helicobacter, behind ulcers. Coconut oil also helps the immune system in general. It's a really good immune response regulator. So very, very good. Coconut milk is also very soothing for that ulcerated gut, helps the healing take place. I recommend using a lot. In other words, you could have coconut oil on a spoon every couple of hours, have a teaspoon of coconut oil, drink coconut milk, have copious amounts of it. But you can also use, for probiotic effect, yogurt and coconut milk and coconut oil and honey in a smoothie with a banana. Really good idea to make smoothies like that for Crohn's disease. Citrus fruits have been shown to reduce Helicobacter. So there you go with lemons. So the acid effect also helping your digestive process, helping to soothe that digestive irritation in the gut is a good idea. Citrus, a little bit of cider vinegar might even be useful there as a similar effect. So the citrus fruits can inhibit urease enzyme activity, which is linked to the ulcer formation, and it can help eradicate Helicobacter. So some good foods to have with Crohn's disease: stewed apples with cinnamon, avocado, salmon, soft cooked brown rice, soft cooked oats, vegetable soups and broths, and plain unsweetened yogurt. So these will be all very good for soothing and healing, feeding that microbiome. Also prebiotic foods and probiotic foods: kefir, yogurt, sauerkraut, fiber from fresh vegetables. Very, very good for feeding that microbiome. Have smaller, more frequent meals instead of big, large meals. Allow your body the time to digest a little bit at a time. That's really helpful to reduce the load on the gut. Give it the energy it needs for healing. And some of these herbs: basil, cayenne, cinnamon, cloves, mixed herbs, nutmeg, oregano, parsley, rosemary, thyme, and turmeric. All of these are called digestive herbs, and they will all help your digestive system, your digestive function to improve. Good fiber. So there's a bit of information here around the benefits of having fiber for your gut microbiome. Fiber feeds the good bacteria in your gut microbiome. They love feeding on fiber, slow digesting fiber that they can feed on and populate the gut with that good bacteria. And here's a few of the medicinal herbs for healing the gut. Aloe vera. Aloe vera is a fantastic gut healing remedy. I would drink aloe vera juice with Crohn's disease and start slowly and build it up over time so that it doesn't cause excessive amount of gut irritation. Over time, that aloe vera will cause a lot of gut healing. Cayenne pepper, we talked about earlier. Cayenne pepper helps to kill the Helicobacter, but it also relieves the pain related with those ulcerations. And you can read a bit more about that there. Golden seal, this is part of this herbal approach again. Kill the bacteria in the gut, seal that gut wall, and help that healing and reduce the inflammation of the gut wall. Licorice has a similar effect, heals the gut wall, helps kill that bacteria, and helps regulate the gut microbiome and inflammation. Fantastic remedy. Mushrooms. Mushrooms are used for various things in the body, but one of the things they do particularly well is regulate the immune response, what's called immune modulation. Using a variety of mushrooms, but particularly shiitake is a very, very good one. Maitake, lion's mane, but generally mushrooms and mixed mushrooms, a mixed combination of mushrooms is the way to go. Slippery elm bark, the fantastic gut healer. You can make a gruel or a drink or a tea out of slippery elm. It has fantastic soothing, healing effect on the gut. And wormwood's also worth mentioning. There's a study here in our detox programs. And then we've got herbal bitters. Herbal bitters are known to help to regulate the gut, but a lot of herbal bitters are antimicrobial as well, but they help to improve the digestive system function in general. And this is a combination of herbal bitters that I use, and I make this up in my clinic. So if you're wanting to get some herbal bitters, just reach out and let me know. And you can order it from this page as well by clicking that link here. Another herb you can use just for soothing, calming the bloating and pain is chamomile. It's a fantastic soothing remedy. And then, of course, it's worth addressing the psychological factors involved, the gut-brain effect is well established. And you can dig into that further on our website. But generally, doing things that are relaxation techniques such as yoga, meditation, tai chi, anything that's good breathing techniques, anything that's stress reduction will help with the gut health. And of course, we do offer a complete Crohn's program, which has your probiotics, your aloe vera, your colon soothing tea, and also a detox program, or you can get a cleanse program, which has most of the herbs we talked about today in there to help to resolve the Helicobacter and to help heal the gut wall. Have a look at that on the page and you can order that and get that delivered. All right, so that's about it for today. I hope that's been helpful and it's given you some hope that there is a solution that you can get to the bottom of Crohn's disease. It may take some time and some perseverance. And our program that we suggest is about 6 weeks long, but it's good if you're feeling like you're improving to look at doing it over another 6 weeks, or even halving the dose and doing it over 12 weeks so that you give your body more time to heal. And if you're needing more help, please feel free to reach out to us. We do offer consultations, this type of thing as well. So I'm Brett the Herbalist, signing off for today. Thanks for watching. Take care and look after yourself.
Herbs. Healing secrets. The secrets.